Good?
Good.
All right, so we're going to do a chemical matrixectomy now of both the borders of this great toenail that are chronically ingrown. Clearly, they're not infected now, and that's when you can do these procedures. Should not really do them when they are infected because the chemical could irritate it even more. So, as you can see you see the toes?
Yep. I can go closer.
All right. So this border has been chronically irritated, as is this one. We're going to remove both of them. Now, we've already anesthetized the toe. You can see the little spots where the injection was. Not a big deal. Now we'll clean it, and we'll use a small tourniquet. As you can see, the blood has come out of the toe. Now what we do is, I've already freed up the margins a little bit earlier, and we're going to take the edge out of this nail. You can see the curvature of the nail, but the root is here. So we will relax your toe. There you go. So we'll try to make this as cosmetically appealing as possible, so we're not taking a ton of nail out, but we want to take enough that tends to grow into the skin. So that piece is loose. We'll do the same thing with this piece here. You have to make sure to cut all the way back under the nail, the nail bed and the the nail fold in the back. A little bit of bleeding, nothing terrible. Now what we do is we will remove that piece of nail. And as you can see, that's the nail that margin of nail is always growing into the skin as it grows. So we have to remove it from the back edge. And what will happen is, after we chemically destroy that, the skin will grow in like that, and there will be no more ingrowns. We'll do the same thing here. Make sure to grab the whole thing. We twist towards the center, and there before we can get the whole piece out. As you can see, that's the whole piece. And now we have a clean margin that's removed here and a clean margin that's been removed there, and now we will chemically destroy it. So dry it a little bit. And we use 10% sodium hydroxide, which is a very strong base, and it will burn, as well as a very strong acid. And then the upside of that is we can neutralize it with some distilled vinegar, much easier. So this has chemical on it, and we will put that in the corner, bury it deep enough so that it will destroy the root. Same with this one. And what I do is I take a little cotton with some alcohol to make sure that I don't have any leakage, so it doesn't burn the surrounding skin. We give that 20 seconds on the clock. And we do that 2 times. And now we're timing it. Feel any burning? Should not feel very much at all.
I don't feel anything.
Just pressure. Couple more seconds.
3, 2, 1. We're good.
Okay. And then we'll do the other ones. See how that leaked out a little bit, so we'll make sure to wipe that off. That's the excess. We don't want that to burn the surrounding skin, so I always wipe around it. But that is now, give that 20 more seconds. All right, give it, let's do another.
We're almost at 20.
Yeah, give it a few more. We'll let that. Mm-hmm. Usually it's 2 applications, 20 to 30 seconds each. Should be adequate for chemical matrixectomy. And that's with 10% sodium hydroxide. And I'm make sure I'm well on the border. And I'm I've done this one. And that's it. Now what we're going to do is with some simple distilled vinegar, this is distilled vinegar, just basic old vinegar, and chemistry, it will neutralize it. And we'll do a little bit more just so that we're sure that it is gone. We fill that with just some I'll let it sit inside the groove for a second, just so that it neutralizes it. And that should do. And then we'll just wipe it off with a little alcohol to get rid of all of it. And remove the little tourniquet. And blood comes back to the toe, but you can see there's not a lot of bleeding because we have chemically burned it and cauterized it. And therefore, the nails will grow in like this, the skin will grow in like that, and the ingrowns will not come back. That's it, easy. Little soaks, and a few weeks will be gone. Bye.